Morning. Melynda, I'm just double checking to make sure you can still hear me.
Yeah. Yes. Good morning, everyone. We're still watching. Yeah, I can hear you well, Christy. And I'm still watching some participants joining. So maybe we'll give everyone a minute here.
It's nice to be able to say good morning and have it apply to everyone on the
right.
So often we do something that's in the afternoon on the East Coast and in the morning on the West Coast. It's morning everywhere.
Yeah, I was thinking about that earlier today. So. All right, well, why don't we go ahead and get started, Christy? It looks like we have everyone who's coming for now. May have some others join as we go. Yeah.
Great. All right, well, I guess I will be the official welcomer to all of you joining us today. Thank you for taking a few minutes out of your, I'm sure, very busy days to join Melynda and myself for this conversation about 2023 growth, thinking about new possibilities, new potential, expanding potential, and sidestepping pitfalls. Before I get started, I'll just make a comment about the fact that Melynda just sent a link to the handouts to everyone. If you haven't had a chance to access those yet, you have the link in the chat, which brings me to kind of the standard housekeeping items for webinars, which I'm sure you've all heard a million times at this point, but we have muted everyone's lines just so that we don't have to ask people to mute themselves. But we would love to hear from you either through the Q&A or through the chat. If you have questions, if you have comments, if you have observations, if you want to tell us about something that you've experienced that's related to the content, please don't hesitate to engage with us. We'd love to hear from you, and we'd love to incorporate that into the discussion today. Similarly, if you step away from the computer today and you have questions later this afternoon or later next week, both Melynda and I would love to hear from you, talk to you about your specific issues, tell you how these concepts can connect to your individual situation. So please, again, don't hesitate to reach out to us. And we do have our email addresses at the end of the presentation, or I'm sure you can figure out how to connect with SimiTree and get in contact with us. Hi, Lori. It's always nice to get a personal hi from somebody on the call. But Melynda, before we get started, any introductory words from you?
Yes, thank you, everyone. Thank you, Christy, and thank you, everyone, for joining us today. This is really exciting, and again, thank you for those of you who came back for part 2. We appreciate that, and we'll look forward to taking a little bit of a deeper dive. And for those of you joining us for the first time today, we will be hitting on some of the themes that you all may be familiar with. So looking forward to getting started. I'm one of the consulting directors in the growth solutions area. So, we work in partnership with Christy and her team. And this is a really, really critical and essential part of the work that you all do every day, and that we do and support you all in your growth efforts. So if we're ready, let's go ahead and get started. If anyone did not get the handout link, let me know, let us know in the chat, and we'll send that again.
And by the way, we do see the chat comments. This is just a confirmation of that. I said hi to Lori, who said hi to me in the chats, but also we had a question about diving deep into the data. And I do want to bring up the fact that, yes, we're going to be talking about data, and we're going to be talking about how data can really help inform a strong growth strategy for your organization, regardless of if your goal is to firmly establish your current position within your market, or if you are looking to grow either within your existing market or in a new market. We're going to be talking about using information to inform all of those decisions, but also about the strategies and tactics that are associated with acting on that data that you see. So we've got a little bit of both sides of that coin, because neither stands independently. It's hard to execute even the best practices and have them be as effective as possible if you don't have the data to inform where you're prioritizing your efforts. And similarly, just having the data and knowing where the opportunities are without that action plan, without those tactics and strategies to leverage that understanding to drive towards your ultimate goals, neither of those are going to stand on their own. So they really go hand in hand. And we're going to be talking about all of that today. Here's an outline of our rough agenda, big topics. We want to just quickly set on the unique challenges of 2023. Now that we're solidly in 2023, you all are living it, and maybe you can give us some feedback in terms of how you expected these challenges to affect you versus how they actually are. But then we're going to spend more time talking about growth strategies given your unique environment and your unique goals, and how MAP, which is our market analysis platform, our data that drives market intelligence, can help make it easier for you to understand exactly what's going on and help you make the decisions that will best impact your organization. Let's jump right into it.
Okay.
So 2023 challenges are here. Like I said, we're all living these right now, right? Oasis E, a significant evolution of the Oasis data set that we have to capture, and all of the logistical and personnel management challenges that go along with that. Payment rate changes for you home health agencies out there. Maybe you're starting to feel the impact of the payment changes to the PDGM methodology. Perhaps you're seeing an increase in your average reimbursement, perhaps a decrease. Regardless, those changes and that uncertainty introduces new challenges for you as an organization. The cost pressures, I think, pervasive across all industries. We have cost pressures from inflation, but particularly in home health and hospice and other segments of healthcare, the staffing challenges, the fact that we're having trouble recruiting and maintaining or keeping our staff just adds exponentially to that pressure of cost driven by staffing shortages, but also consumer expectations. As we continue to move forward in the healthcare world, we see perspectives changing in terms of how individuals are engaging with healthcare providers from, a decade or more before, of really being in kind of a passive position and having your healthcare experts that you go to being much more engaged consumers, and the impact that has on the delivery of care. And then, of course, competitive landscape changes. We see a variety of environments across different markets in this country. Some are really stable. You see the exact same providers holding essentially the exact same positions and relationships. And others, more often, we're seeing new providers coming into the space, a consolidation of multiple individual organizations coming under one umbrella, new referral partnerships being built, and changing relationships and patient movement patterns due to those changes. That's kind of where we are to start with, and that makes it more important than ever to really rely on being thoughtful and deliberate about how you're approaching your strategy within your market. It's harder to be successful now in just being a passive participant in the market, kind of like consumers are no longer as passive as they used to be. As post-acute care providers, being passive and just waiting for things to come to us, trusting that people understand the value of the services that we're providing, waiting for those patients and those referrals to come our direction may not be the recipe for success that it once was.
For those of you who didn't look in the chat, if you're looking for the handout, I put it in and I sent it again, but check the chat to see if you have the link. It's not an attachment, and sorry, Christy, to interrupt. No, it's not an attachment. It's actually a link to the information. Okay.
All right, so we can go ahead and just build out this whole slide.
Sure.
I forgot.
Okay.
Built it. Let's just talk about it kind of all in one conversation. So with 2023 and the challenges that are ahead of us, what we're hearing most frequently from clients, and if they aren't telling us this as we're going in and working with organizations across the country, we're often advocating for these priorities. One is efficiency with staff time. If you have limited staff and difficulty staffing all of the positions in your organization, we need to be really efficient with staff time, not just because of the staff limitations, but also because of that cost component. With human time being more costly than it was last year, 2 years, 3 years ago, it's more important than ever to be really thoughtful about how our staff are spending time. And two, ensuring the right mix of patients. And when we think of right mix of patients, it can be both a financially driven decision as well as a capabilities and organizational goals kind of decision. So the right mix of patients may speak to the type of services you are best equipped to deliver or that you want to be delivering to your community most prominently, and thinking about what types of patients, what patient conditions fit within those service excellence areas. But also it may be thinking about the types of referrals that you're getting and that financial component. If you're struggling financially, you may be thinking about trying to drive more referrals from institutionally based patient referrals so that you're getting that bump on the PDGM payment methodology. Or you may be looking as a hospice to drive patients with certain lengths of stay, depending on both the financial and maybe the cap implications of those decisions. So there are a couple of key potential strategies that may resonate with you that may be most appropriate for your organization. There is no one size fits all, so we can't tell you through this kind of two to many environment what's going to be best for you. But some things to think about. A potential strategy for your organization, a focus for 2023, maybe just to focus on strengthening your current best referral relationships and really building in that fortitude, that defensive wall, that tight relationship that's going to ensure the longevity of those relationships. Or maybe you're looking at expanding, you're ready to grow, or perhaps you've maxed out what you have in your current market, but you have additional capacity. Let's think about focusing expansion efforts where you can say yes to referrals. Because a lot of folks are having a hard time saying yes right now because of those staffing limitations. The things that we often hear when we're having these strategic conversations, you know, an awful lot of people are kind of in survival mode right now, but we also talk to folks who are like, okay, I think we're doing well with the changes and we want to expand our service area or open a new branch, or we want to add a service line. We're hospice today and we're thinking about adding home health, or we're home health today and we're thinking about adding hospice. But one of the common things that we're hearing that we've been talking about already is that we don't have enough staff to take referrals today, potentially in kind of our traditional areas of service delivery. A lot of these organizations coming to us are saying these things, but when we ask them to kind of give us a recap of where they are today, they have a hard time explaining their current position and how it's changed in recent years. They're going through these growth motions because they think they should be thinking about growing, but they haven't examined deeply their current operations and opportunities. So here's an example of what we find, and this is using data from our market analysis platform where we pulled market intelligence, we pulled information about all of the providers operating across the country and patient movement patterns, understanding where patients are being discharged from hospitals or skilled nursing facilities and coming into home health or hospice services. This is real information, so we wanted to give you an example of what we're seeing, but we've blinded the provider-specific information so that we aren't calling anyone out, putting anyone on blast, as the kids say, I think. I'm not entirely sure I used that right, but what we're seeing when we look at some of this information is we're examining who's operating in a market, how concentrated the market is, meaning do we have a couple of providers that are capturing the bulk of services that are being provided, or how fragmented it is? Do we have a ton of providers operating in a space with each provider taking a pretty small piece of the pie? And what we see sometimes is we may have a traditional leader in the market who thinks they're ready for growth, but when we look at their last few years of performance, they've actually been losing market share, which tells us that they may want to focus on reinforcing their core market because that's where they're already operating, that's where they already have the relationships, and building in that space may be a more effective strategy than trying to expand into a new space.
So what we recommend, and Christy, thank you for really setting that up, is looking at your core market. If you ever lose share in your core market, that's reason for alarm and urgency to get out there and really maximize those current relationships you have, whether it's through market share or market penetration, and really building deeper penetration into those referral partners and referral source opportunities that you already have is where you want to start, because if you lose your core market, you likely will never get it back. And then you're going to be in expansion mode in uncharted territory where you have to hire staff, where you have to build new relationships. And that's not really operating from a position of strength. So we want to make sure that you have a strategy that's built on share and penetration, using data to validate how you're using your resources and how you're maximizing those relationships. So ask yourself, have you trained and prepared your sales team? That's key. If your sales team is not trained and doesn't know how to use data and is just going out to the same places they've always gone, saying the same things, seeing the same people without any market intelligence, you're not operating from the optimal position. You need to really reinforce that and be sure your sales team has the tools that are going to make them very competitive. So you want to make sure that you're maximizing your collaboration with clinical operations too. So don't operate in a silo. Be sure that you're building a partnership with your clinical operations team, because they're going into the same places that you're going often. And so you want to make sure that there is collaboration, there is partnership. You are saying the same thing, that you are watching each other's backs and making sure that you're looking for opportunities from both positions, and that you're meeting in daily, if not daily, definitely weekly, to have conversations about what your strategy is, where you're going, what happened yesterday, what are the changes in the marketplace, and then make sure you're using your market data to really point your resources deliberately, intentionally, strategically to where you want them to go. And you want, as we said earlier, you want to go to places where you can consistently say yes, where you can be your best, where you can provide the greatest customer experience, both for your referral sources, your referral partners, and the consumers. So let's talk about what that looks like. What does it really mean to get back to basics? So there is a proven formula for success. This is probably, one of the most important takeaways for you from this session today. So the first part of that formula is territory management. So that's where you really drill down on each individual's territory, where you have them assigned. Is it the right composition of accounts? Does it make a sense geographically? And then what does your data tell you? Using your data is going to show you if you have the right composition for that individual who's managing that territory. And what are the gaps? What are the opportunities? What is your position? We've all been there where we've said, oh, we're getting 75% of the referrals from that hospital. And then we go in and we look at the data and we realize it's really only 40%. And there's a lot of opportunity being left on the table. So you have to do this starting with data and validating how you're training, coaching, directing your team. So call volume. So once that's been established, you want to be sure that your territories are all set up based on the methodology of your rating and ranking accounts. So you have your top referrers. Those are your A accounts. Your B accounts and your C accounts are those mid-level referrers versus your C accounts, which are the ones who are probably your smaller numbers of admissions per year. But that's where there's usually a great deal of opportunity. And you'll see that in the data, because if you're getting, one or two admissions here or there from what you consider a C account, the rest of their referrals are going somewhere, and the data will tell you where. And then you can build your strategy on where you're going to go and what you're going to do, how frequently you're going to go. And then, of course, the technique, what are you going to do when you get there? So that's where the sales training really is important, because you want to make sure that your team is well informed about where they're going, so that when they get there, they know what solutions they have available to provide, what the pitfalls probably are for that referrer, what the opportunity is for growth based on what you see in the data, and how many other providers they may be using. And just because, this is kind of a sidebar note here, just because a health system owns their own home health or hospice provider doesn't mean by any stretch that all of their referrals are going there, because there are very few providers out there who can handle every single referral that someone is going to make, or they're really operating on patient choice too. And you may be really good at marketing and advertising and community engagement, and you have people asking for your agency by name. So don't make assumptions. That's what the data is for. None of these are keys to success independently. They all equal growth, but you have to use and employ every one of them. So in terms of really getting back to basics, there are only two ways really to increase your admissions, and that's competing for referrals and winning. And what that means is taking market share and then expanding your current referral partners' use of your services. That's penetration. So you want to make sure that your strategy is built on both. And this is where looking at that data, living in that data is so important. And I've had people tell me, well, it's updated every quarter. So I go in every quarter and I look to see what has changed. That's great. And you should do that. And you should refresh your sales strategy every quarter based on your own internal data, crosswalked with that market data from the Medicare claims that have been updated, and make sure that you know exactly what's happening in your territory and in your marketplace. But really using that data day in and day out and putting it in the hands of the people who are going into those accounts day in and day out is going to help them know when to compete for the referrals and win and focus on taking market share and or expanding the use of your current referral partner services. And honestly, getting more business where you're already getting business is going to be the fastest way to drive growth. You need both, but there's a long-term and a short-term strategy here. So to update your strategy, here's just some 5 steps that you can take away. And this will help you refresh, update, add to whatever you're doing today. So check your relationship with operations. And part of that is going where you can say yes. It's honestly a waste of time that does more damage to relationships to send your sales team repeatedly where you have to say no. Focus on where the data shows the greatest opportunities. You have staffing, you have support, you have salespeople who can go in and handle those accounts, take care of their patients, and say yes. That's where you want to shift your focus and use your data to do that. And that may be your internal and the external data that we're talking about today. We talked about consumers. Consumer demands are high. The pandemic really set the bar even higher for what today's consumers expect from us. And most consumers come to us somewhere between knowing they have a problem and knowing there's someone to solve it, and then making the decision. So whether it is consumers or even your referral partners, the people who show up, deliver on what they promise, and make it easy to do business with them, or who will continually get those referrals and bring those patients onto service. You want to make sure that you have success metrics to track, because if you don't, how do you know if you're successful or not? And how do you know when you get there? So make sure that you have metrics. Every individual in your organization should know what's expected of them and what their metrics are. And that's how you create accountability. And accountability can be empowering and exciting. I'm going to pause for just a second because I know we've had a couple of comments drop into the chat. Okay, thank you, Christy.
Yeah.
Okay. All right. All right, so let's look at a couple of strategies here. So we talked about strengthening those best relationships. Again, this is the fastest way to see results. So you want to make sure you're creating with using that growth formula for success, supported and validated by the data. You want to make sure that you're defending and potentially growing your current relationships. What that does is not only strengthen those relationships, but build a barrier to entry from your competitors coming in, or even new people entering the market, new competitors entering the market. And that is going to be the way to protect your core market and have longevity for the long term in your marketplace as the market continues to change, because we know that competitors are not going to stop coming. We know that changes in the way we do business will not stop coming. So let's make sure that we're shoring that up and that we're developing new relationships as well as strengthening the ones that we already have. All right, so what does that look like? Do an inventory, really, or an assessment of what your relationship and your positions using the data look like today with your current referral sources. Remember, I said, a lot of times at some point, many of us have said we thought we were getting all the business from that hospital or maybe that physician's office. And we look at the data and we realize that we're not. We might be getting 50%. But then the rest of those referrals may be divided up over several providers. And when you start to see, 5%, 3%, 2% or less divided up over several providers, there's your strategy. Go in and take back that market share that clearly there's not brand loyalty to that many small providers divided over that much market share. If you're the lead provider and you have most of that market share, great, then go in there and continue to build that relationship. So what is that room to grow? Well, again, the data is going to tell you that. You can look in this data and see where those referrals are going. You can see what types of patients, where they're coming from, where the referrals are going, and who else is receiving them. So it's going to really give you, and Christy showed you a couple of slides earlier, really give you a good glimpse into that competitive landscape. So where can a good relationship go to great? So remember, I said you want to rate and rank your accounts by really the admission volume and look at it on an annual basis. But when you look at your B's and your C's, prioritize by looking at which B's can you move up to A's, which B's, those middle referrers, could be or should be A accounts. And then what's your strategy to get them there? And the same with your C's. And remember, I said typically when we look at a territory list, we see a handful of A's, probably double the number in B's, and then usually dozens, sometimes hundreds of C accounts. And those are where the opportunities really are. So look in the data and see who is on that C list that really could move up. Where can you consistently say yes? That's very important. I talked about why you want to make sure you're sending your people, that you're employing all of these, but do this where you can say yes. Don't go to this much trouble to build this great strategy if you're not prepared to take the referrals. If you can't say yes, you're wasting your time and resources. You want to go where you can say yes. And then how do you protect against declining referrals and trust? Well, one way is, again, go where you can say yes, where your people can articulate the value proposition, where you know you can provide a consistent solution.
So I'm going to launch off of what Melynda was just talking about and also address one of the questions that came in. I addressed it individually in the chat, but figure that other people may be wondering the same thing. Where can we get this data? Well, there are various sources of data. You may even have it available to you today, but it may not be something you're taking advantage of, or you may not find it to be as useful as you would like it to be. But there are various organizations out there that can prepare this information for you, and we are one of them. So the market analysis platform that I mentioned earlier in the conversation today is an online reporting tool that provides individual organizations with access to market intelligence, with access to information about who's operating in a space, what their market share looks like, how that has changed over time, and then these patient movement patterns. how many patients are being referred to home health or hospice from various hospitals, skilled nursing facilities, physicians, both physician groups and individual physicians within the market, and then which agencies are capturing those referrals. And do we have one that's getting the most and then a bunch of others that are getting kind of the scraps, or do we have those referrals going to a whole bunch of different organizations with each agency getting a small piece of the pie from that particular referral source? So if you don't have access to this information today, our position is, one, we think that this information is invaluable for making the best decisions for your organization and making the most effective use of the time that you're investing into this work. We want you to be using this data, and we also want you to be using the best practices and techniques and tactics. And if we can help in either of those two areas, we would love to. So we do have access to this information through this interface that we'd love to show you in a one-on-one session specific to your market if you're interested in learning more. But what we have today, we're giving you a couple of screenshots, a couple of examples of the types of information to focus on the value of that type of information and how it can be employed to best meet your organizational goals. So here's an example of that, consistent with what Melynda was just talking about. What is your position with your referral sources? I was nodding my head when she said, don't assume that just because a hospital has their own home health agency, that home health, that hospital is no longer an opportunity for you, because it is not uncommon that we see, sometimes as low as 20-something% of referrals from a hospital going to their own home health agency. They may have a small home health agency. They may not be able to service all the types of patients. They may have other challenges that are creating those dynamics, or it may be a matter of consumer choice. So it's helpful to understand what is your position with your existing referral sources. And from that position of understanding, be able to ask yourself, is there room to grow? We do see different kind of max volumes. So for some hospitals, we see 60, 70, 80% of the referrals going to one home health agency. In other communities, there isn't a hospital that has more than 50% of their patients going to one home health agency. So there are various things that could be influencing the reality of how this all happens. But step one is understanding what is happening and thinking critically about what you do with that information. So is there room to grow? And if so, who else is receiving referrals from that particular referral source? Who specifically are you competing against so that you can approach the conversation with that referral source in the most meaningful way possible?
And we had a question. Did you see there was a question about traditional Medicare versus Medicare Advantage, and is this different?
Yes, and I will talk about that. Just out of curiosity, does the audio still sound okay?
Yes.
Okay, it started sounding weird on my end, so as long as I sound good to you all, I'm good.
Yeah.
So what you're seeing here is just traditional Medicare, but we are working on getting Medicare Advantage data in there, and we'd be happy to talk to you about how that impacts your specific community in an individual conversation, because it has different effects in different parts of the country. So yes. All right, so another example, Melynda talked about good to great opportunities. And I think there's a build on this one because I wanted to call out a couple of specific patterns. Yeah, there we go. All right, so here are a couple of different examples. What we're looking at in this view of the data, again, provider names have been blurred out, but we're looking at, in the columns, the hospitals that are referring the most patients to either home health or hospice. And in the rows, the percent of those referrals from each hospital that each home health agency in the community is receiving. So you can see for those first two columns that we have hospitals that don't have super tight referral relationships. We have fewer than 50% of patients going to any one home health agency. So that presents one conversation when going to those hospitals. And that first hospital has the one dominant partner and then nobody else getting kind of a bulk of referrals, although we have some getting more than others. Second column, we have two primary referral partners. But then the third and the fourth column represents hospitals that have 86, 78% of their referrals going to a single agency. Those are tighter relationships, may be harder to break into, and the conversation with those hospitals may be less about how you are better than their primary referral partner today, but more about how you can supplement their referral patterns. If that provider isn't a good option for a particular patient due to capacity or special needs or anything else, how you should be the next one that they think about.
Thank you, Christy. That was a great setup for this. So your risk protection strategies, know your market share, of course. So know where you stand, have meaning behind why you're there when you're making those calls on these particular referral partners, referral sources. Make sure your team understands the competitors, the strategies, their tactics, and really most important, and this is what Christy was saying about, know your value proposition and differentiators. That's really what's going to set you apart from your competitors, because most folks in our industry, we're really good at telling everyone what we do really well, but knowing what the pain points are of your customers is really what's going to differentiate you from other providers. So your team should be prepared to clearly and simply define what that value proposition is through the differentiators that you provide, the things that you do that you're really good at that will make a difference. But what does it mean to your customers? How are you going to provide a solution to them? And really be that easy button. But remember, we said, the team that makes it the easiest to do business with and consistently say yes and provide solutions is who's going to continue to get that business. All right, so let's look at strategy number 2 here. So this is focusing on expansion efforts. So your geographic focus, again, find patients where you have available staff. We hear a lot, we just don't have staff to go there. I hear we've closed down a certain zip code, we've closed down a certain county. If your agency's in that position right now, you're not alone. And you know what? Your referral partners are right there with you. So they understand. However, use your resources wisely. You have a finite number of resources, train them well, use your data to direct them well, and then use them wisely. And that's going to help you maximize your efforts, not just for your clinical staff, but your marketing staff too. And that's also going to help you retain that staff. So you're not in constant recruitment mode. If you supply and develop people with the things that they need to be successful, they will stay and they'll help your organization, of course, be successful as well. So the types of referrals. So you want to look at, the potential referral volume, and you want to look at partly at the overall volume, but also at the current competitors. Remember, we talked about where there's an opportunity to take market share. If you're looking at your data and you see you want to go, expand into a new area, or maybe you have new staff in an area for the first time in a while, and you want to go back in there and you see that there is a provider who has 80% of the market share, that's fine. If the other 20% is going to, a lot of providers that have 1 or 2% of that remaining market share, just be intentional in how you're doing that. And then what types of referrals are smartest for you to go after. And again, the data will help you do that. You can look at the patient conditions, the type of care required. You can look at that both from the referral perspective as well as the competitor perspective. What are those matches and partnerships and gaps going on in your marketplace? And then you're better prepared, and your people are better prepared to engage with those partners and potential partners, whether they're hospitals, physicians, or SNFs in your market. So how do you find the areas of opportunity? So you want to make sure that you're looking at your current market penetration, where the patients are concentrated, where the referrers are that you have relationships with are concentrated. And again, where you can say yes to referrals. I know I've said that many times, but I can't say that enough. Make sure that you're really using your resources wisely and building relationships by being that solution provider. All right. So when you look at the data, again, look at which providers are receiving those referrals or should be. So again, look at where geographically those patients are concentrated. So all the way back to the growth formula slide, when we talk about territory management, you want to make sure that your team is aligned with where those patients are concentrated, and using your data is going to be the best way to do that. Take the guesswork out of it. So look at your internal data on where you've been doing business, which for the most part will also be, at least from your Medicare patients, in that market claims data, but also look at where the patients are concentrated holistically across your marketplace. So when you're looking at potential markets, you want to do the same thing. What makes sense? Don't feel like just because there's an adjacent county, where you think there is, we hear that a lot. We think there's opportunity there because maybe there's a hospital there, there may be some housing developments going on. That's great. So yes, start looking, but look at what makes sense and also make it scalable. You have to do any growth plan, especially an expansion effort that you build, needs to be a responsible growth plan, because if it's not, and you start taking a lot of referrals suddenly and your clinical operations partners are not yet prepared for that, then your outcomes are not going to be sustainable. So make sure that it makes sense. And then look at those other agencies. Remember, we said, look at where you see brand loyalty, and bigger than that, where you don't. Because if you're seeing a lot of agencies with a tiny amount of market share, that you want to take a deep look at that area, because something's going on there that really looks like an opportunity. And also make sure that you're matching the type of business you're going after to those referrals that are best suited for your agency, because again, you want to be the solution provider. You don't want to experiment, especially when you're in expansion mode. You want to make sure that you have a solid strategy with the resources to support it.
All right, so we have a few more examples here, and I'm going to go through them relatively quickly because I want to give time for some wrap-up thoughts. We're also addressing questions as they come in, but want to give time for any that we want to talk about as a group as well. And again, this is using an anonymous market. It's actual real data, screenshots from the actual system. But if you're curious about how some of these patterns play out in your specific market, we'd be happy to have that follow-up conversation with you and show you a part of your market. But Melynda was talking about who's referring to post-acute care today. And again, I'm going to ask you to click through the next to give a couple of builds here. Melynda, I think, there we go. All right, so what we're looking at here is a list of the hospitals that are operating in a particular community. On the far right-hand side, you can see that they are sorted by the total volume of discharges. And we actually have more current information in the system now. We have data through second quarter of 2022. So we're showing the total discharges for the calendar year 2021 in that far right-hand column. You can just see, generally speaking, which hospitals are serving more or fewer patients. This may be very familiar to you in your existing market, but maybe if you're looking at expanding into a new market, this sort of specific knowledge, not just kind of gut sense that, University of Washington Hospital is really big. Well, maybe they're really big in the community over next door to you, but maybe they don't serve as many Medicare patients. Maybe they're bigger around caring for maternity or other service lines that are less specific to what you do. And then what we're looking at for each one of these individual hospitals is how do they engage with post-acute care today? I'm going to focus on those green circles first, where we see hospitals that are referring a higher than national average volume of patients to home health and to hospice. Well, those are hospitals that already have practice patterns that are referring patients, whether it's because they have the appropriate types of patients or because that's just how they operate. It's kind of their current patterns of behavior. They're already referring a lot of patients to home health and hospice. You maybe don't need to convince them of the value of the work that you do, but you need to help them understand why you are a good referral partner versus who they're working with today. On the flip side, we might look at hospitals that are referring a low volume of patients to home health or hospice, or a high volume of patients to skilled nursing facility, or they're discharging a whole bunch of patients with no post-acute care at all, and maybe they're missing an opportunity to improve the patient's outcomes, the patient's experience with the complete case of care that they're engaging in, by not taking advantage of home health and hospice resources. And perhaps that's a different conversation with those hospitals to help them understand what they might be missing, and then why you are a good partner to help take advantage of those benefits, increasing the total volume of referral opportunities in your community overall. On our next example here, we are looking at a picture of where those hospitals are discharging their patients. So the heat map on the left-hand side of the screen gives you an understanding of the patients who are discharged to home health or hospice from a particular hospital. Where do they live? Again, speaking to that issue of where can you say yes, it would be counterproductive to invest a lot of time engaging with a hospital who is referring all of their patients to an area where you're already over capacity. Not only is it not the best use of your time, but if you get that referral, if you work hard to get that referral, and then you say, oh, sorry, we don't actually have anyone who can admit that patient, you are potentially doing long-term damage to that relationship and the future opportunity of working with that particular referral source. So where are the patients located? And then, like we've talked about before, clicking on that build there, specifically which other agencies are serving them today, whether that's you and understanding your position in that picture, or if it's a new partnership and you don't really have any understanding of who they're working with today, getting that understanding and knowing who you're competing against, and therefore, what you bring to the table, what you emphasize in any conversations with those referral sources about why you versus who they're working with today. Much more effective than a generic message. Mm-hmm. So we mentioned before the idea of just understanding what's going on in the market, who's operating there today. And again, we have a couple builds on this one, Melynda. Do we have a ton of providers? So here's an example of a fairly fragmented market, no big players. Even the top providers are getting just a little bit of market share each. But also what's going on is, do we see a lot of change? If so, that may indicate one environment for you to bring in another change to. Maybe that's indicative of a market that's really receptive to change and improvement versus something that's really kind of stuck in habits. But even if there's not a lot of change, does that indicate that nobody has tried to introduce change? And is that maybe an indication that it's important to bring something new to the table? And then again, who are the players, particularly if you're looking at a new market and you're trying to decide if market A or market B is better for you to expand into. If you see folks operating in market A that you compete really well against, and maybe market B you have less differentiators, perhaps market A is a better opportunity as the next step. So this is another view, a little bit of a different picture of a market, just to prove to you that I wasn't making it up when I said we see really big differences in different markets. But here we've got 3 players that are all in double digits. For the last slide, nobody had more than 5% market share, and the biggest provider is capturing a full third of the business. So that's telling us, and is growing or has been growing for the last year. So that tells us something that helps us inform how we potentially approach our involvement in that market. If you're looking at specific competitors, it maybe somebody that you compete well against, and you want to get a little strategic about you offer better services than agency A. Well, where is agency A getting their referrals from today? Are they getting them mostly from hospitals or mostly from physicians? And then specifically, which hospitals, which physicians are they working with? That may allow you to prioritize those outreach activities and those conversations to increase your own referrals. And then we think about what types of referrals are best for your agency. We talked way back at the beginning about being thoughtful about the types of referrals that align with your organizational goals or needs. One of those decision points may be that you're looking to drive a higher volume of hospital referrals or a higher volume of physician referrals. just depending on what your situation is as an organization. You can not only look at the physicians referring those community referrals to home health, but you can see the referring physicians associated specifically with hospital referrals. So if that's an area where you want to focus your time and attention, you can look either at those community referrals physicians or the hospital referrals physicians. And again, prioritize your time appropriately. We even have filtered on that last screen the idea of looking at orthopedics. So perhaps you've got a great both hip and knee program, a great team of therapists, and you want to really maximize what they're doing. You're not just looking for those hospital referrals, you are looking for the physicians associated with hospital referrals in that particular specialty. All right, so we talked about the market analysis platform. We've shown you some examples. And again, if you're interested in a conversation that's specific to your market, if you'd like to see it in action with real data, and I'm a data person, I love looking at all kinds of data, but from more than 20 years of experience in being a post-acute care data person, working with home health and hospice agencies, I know there is nothing like looking at your own data to kind of get the value of it. So we're happy to have an individual conversation where we can pull up your market and you can kind of connect the dots specific to your world. But we have been showing you what we're doing through the market analysis platform. This is a collaboration between our analytics team, which I lead, and our growth solutions consulting team, which Melynda leads. We worked together for years developing customer specific reports in order to take all of this sometimes convoluted, complex information that our clients maybe had access to, but they didn't really know how to interpret it, how to process it. And oftentimes it was just an overwhelming amount of numbers. We would work together to create reports that would digest the information and call out important observations that would really inform the decisions that our clients are trying to make. And as we did this for a number of different clients, we're like, hey, maybe we should make this available more broadly through a self-serve tool that we can give to other organizations. So we really wanted this data to be used by you busy people. We focused on the most important information. We focused on organizing it and presenting it in a way that would make it easy to identify those key observations and trends. You don't need any downloading. You don't need a data scientist. You don't need significant dedicated hours to analyze the information. And that was really our goal in creating the market analysis platform. And we're glad to have it out there in the real world for a while now and get the feedback from clients about how it's useful. So,
and how easy it is to use.
So that's what we're going for. I like easy.
Exactly.
We do the hard work to make it easier for you. That's our goal.
Yeah, because we want you spending time building those relationships, not necessarily, taking deep dives into the data. Let us do that. And then we can show you in the formats that you've seen today, which that's what all of this really comes down to. This is how you're going to build your strong business development and enhance your referral management. Know your proposition. What's your why and why it matters to your referral partners and the consumers in your community. Apply the best practices and then use data to drive your decisions. So make sure you're validating and using that data to shape and execute your decisions. So quickly under growth solutions, this can apply, of course, to, these are our specialties, intake and referral management. Strategic market analysis and planning. So, short and long-term planning, usually a little bit of each because we live in an agile world and we want our clients to be prepared for changes. Sales and customer experience training, that's where the best practices are developed. And then, of course, plugging in as transitional leaders, coaching, mentoring, and developing teams to be able to execute on what we've talked about today. And as well, brand refresh development and marketing communication strategies to make sure that your presence in the community, your communications, your messaging are all in alignment and are all engaging your customers and your communities in the best way to help you grow and serve more people. So what we want to do is make sure that we've helped you prioritize and focus how to use your resources. That's part of what we do. That's really what Christy and I do in collaborations with Growth Solutions and our data analytics team to make sure that you're going after the best market segments that match your resources in your business so you can be the best solution provider in your area. You're going after the right partners. You understand the competition because all of the things we've talked about today are built on positioning and being strategic in your approach. And then evaluating your options before investing those time and, the time and resources that you have that are finite and that you're pointing them in the right direction, giving them the right tools, the right support, and the right development to be successful. So Christy, you want to tell us how you learn more about MAP, how we can be reached?
Yeah, just to wrap it up here, we've got a couple of ways that you can reach out to us. You can visit our website. We've got contact forms there if you want to use that. Drop us a note here before you pop off. Or of course, you can send us an email. We'd love to answer questions that are specific to the challenges that you're facing, whether it's in developing your value proposition and refining that, or thinking about how you manage your team and your activities. Thinking about that Venn diagram, all three of those areas are important. Value proposition, Melynda and her team can help with that. Building those best practices, Melynda and her team can help with that. And then getting that data that you need to inform the decisions that you're making, the market analysis platform as a subscription, or Melynda through an engagement in working with that data and providing it to you in kind of a one-time format. All of those are opportunities there. And then we let you do the stuff that we can't do. Go, manage your team, manage those relationships with your referral sources, take great care of your patients. Let us help with the stuff that we can if you need it. And we'd love to talk to you about what specifically you're thinking about, struggling with, wanting as a big goal for your organization's success.
Absolutely. Thank you, Christine. Thank you, everyone. We know that it is, a challenge sometimes to spend an hour during the middle of your workday, but we appreciate that you chose to spend that hour with us, and we'll look forward to talking with you soon. Take care. Thank you.